Welcome back to another PT Pearl within the Optimal Body Podcast. Today we are diving into disc herniation. So this is a very, very prevalent...
Is that the same thing as a disc bulge?
Oh, yes, it is the same thing, but I don't like that word.
That's why I brought that up.
We're going to dive into a lot of things.
It's going to be an interesting talk. And disc herniations and low back pain in general is just almost a taboo topic to talk about and to dive into because there's so many different things said about it.
And we don't want to take the experience of pain away from anyone. Whatever your pain experience is, your diagnosis within your back especially, it's very personal.
Jen and I both have worked with people who have disc herniations or have come in with those kind of diagnoses, anywhere from just having had it in the past few weeks to having had a 20-year journey with different disc herniations or disc issues.
Our main goal is to take the fear away from these diagnoses.
Yeah.
I mean, especially that's why I don't necessarily like the one of disc bulge. Like, it just sounds scary. And the reality is, though, that might be what's showing up on the MRI and your body is at this time presenting, your body has this amazing ability to adapt, to change, which is why it does then adapt to this more funky looking disc maybe, but it has the ability to go on a journey and change and adapt back. And so that's why nothing is bulging out of your back or anything. It's just, it looks a little different. And so my main goal for clients especially is to just take the fear away from the diagnosis. Diagnoses stand. We both know people that have experienced the diagnoses, had some type of surgery with it, and it has really improved their quality of life. So again, we're not anti-surgery. We're not anti-diagnosis. We are pro-awareness.
Well, yeah, and there's a time and a place for all of the interventions that we talk about and all of the interventions that are talked about in research or in studies or whatever. The anatomy of a disc, we do have this more fluid type matrix, they call it, this fluid type filled area in the middle that is the nucleus or the nucleus pulposus, which literally means the center pulp of the vertebrae. And then you have these annular fibers that then connect into the vertebral end plates or the bones in our vertebrae. And so there is this fibrous outer tissue and this fluidy matrix in the middle that goes through a lot of changes throughout life.
Like you said, there's always going to be different kinds of pressures that are happening around the disc. Even sitting, it's going to be a different pressure than laying, than standing.
Or if you're sitting like this, hunched forward, or sitting with your back extended, pressures are different.
And that's not bad.
No.
It's normal. It's 100% normal, just as it is. And as we age, our disc changes. Also very normal. Like a diagnosis like stenosis, which is just narrowing of the vertebrae closer to each other because the disc is essentially shrinking a little bit. Normal.
Or for this one, I think there's a study right here that I'm going to take a look at, disc degeneration, which just means that the disc is looking different on the image. Again, 20-year-olds, people in their 20s, 37% of people had disc degeneration. 30-year-olds, we're already past 50, 52%, 40, 68%, 50, 80%, 60, 88%. And that's just people showing some degree of disc degeneration.
So when you're saying the number, you're saying the age, right? Just want to clarify.
Yes, 60-year-olds, or the decade of 60, 88%.
88% have.
The decade of 50-year-olds, 80% have disc degeneration. This isn't specifically herniations.
Right.
But that just lets you know that if you happen to be 50 and you go in and get an image of your back and they say, oh, we see some mild disc degeneration or wearing down of your discs, the last thought in your mind should be, oh no, disc degeneration. Because guess what? 80% of the other people that are at your age are in the same boat.
Yeah.
And this is asymptomatic people.
Yes, meaning they have zero pain, no symptoms. And that is why initially as well, we cannot just say that what you see on the MRI is what you're feeling. So this is where it gets tricky because obviously if you see the MRI and you're having pain, you want to know and understand this is why I have pain. We're seeing that the disc is now pushing one way versus another more so, and it could be initially pushing into more of a nerve, so almost causing compression on that nerve. And what that will signal to the brain is this initial onslaught of like injury. So all of a sudden you're feeling that initial experience of pain, and that is real. Like 100% that's real. What you feel, that
all
tissue.
All experience of pain is real.
100%. All experience of pain is real. We're just saying when it comes to tissue damage, we can't always say that tissue damage is 100% the cause of all pain.
So they separate out a little bit what kind of, and you would not like this, they actually use the term disc bulge.
Yeah.
But it's a systematic review, and there's like 3,500 or more subjects in this. So it's one of the higher levels of this grouped research, which is why I like these. And they actually have decent like methods and stuff. So under the disc bulge category, 30% of people that are age 20, 40% of people age 30 or in their 30s, 50 within their 40s. So it just,
so 50% of people who go and get an MRI who don't have pain will
some sort of
experience
small disc bulge or change in their MRI.
Yes.
The next category they have is a disc protrusion, which is a little bit more advanced of a disc, or that's kind of how they parse it out in their methods. So a disc protrusion, which yes, is a little bit further of a size in that disc bulge, slightly lower numbers. So 20% of people or 29% of people in their 20s
will have one.
Will have a disc
and
protrusion.
They don't have any pain.
With no symptoms. And that kind of steadily increases up to about 43% of people in their 80s. Will have them, which is actually surprising because your discs lose a lot of hydration and height as you age. So, but still, people who have these and don't have symptoms, further kind of supporting this idea that, okay, what we see on the image does not always equal pain. There should be a big sign that says that we can just say, okay, that is what my image looks like. And I can still change the way I feel as I move, regardless of how that thing looks.
100%. And I think this got even brought to light for me personally, even more when I was in PT school, and we got to see a video of a young man who literally fractured like completely his humerus, but it was still inside the skin. So nothing, like not a compound fracture, it didn't come out of the skin.
Humerus being big bone in the arm.
Yes, the big bone right here. This person initially had a lot of pain, did not have the accessibility to get medical treatment. So eventually learned how to use the arm in that condition and had zero pain. Like literally you watch him like move his arm up and down and it just looks floppy and absolutely painful. And yet this person has no pain. And that's because he's taught his brain to respond differently to what is happening at the tissue. You can change the way that your brain responds to that pain. Think of the different avenues to our body responding to things, right? So we have the avenue going up to the brain. That is the initial, like someone hits you. Those signals come up to the brain and it reports a signal. Now we have the signal that comes from the brain and comes down to our body part and also reports pain. So that's where we start to get to work on different aspects of the brain. And we're going to continue to talk about this all throughout probably every podcast that we have. And we're going to give different kind of take-home tools and everything that you can use.
Especially in relationship to the back. And we will definitely bring up more diagnoses in the future about the back. But just that imaging, again, great. It can tell us some things. It can tell us some things about how the tissues look. And then we can do something about it.
Right.
And then we can actually take action and form this thought in our mind that we are strong, resilient, amazing beings. And
adaptable.
And our tissues adapt to how we load them and how we move and the thoughts and things that we surround all that with.
Yes, this might happen within the back. Say you're only moving in one certain repetitive motion over and over and over again, and you haven't been taught, like, hey, what if I didn't always move through my back and I actually addressed the mobility of my upper back, how my upper back was moving to take pressures off of my low back? Hey, what if I actually addressed what's happening at my hips and improve the mobility of my hips so that my back doesn't have to take so much load? I mean, rather than talking about what we need to be avoiding to avoid a disc herniation, it's what could we be adding into the body so that we avoid this experience of pain based on one simple motion that we're continuing to drive and hone in on. If your disc is moving around that much, it's because you're taking away the mobility of other parts of your body to move well, and you're only placing it at one.
When we look at the studies in low back pain or disc herniation in general, within 2 months or 8 to 12 weeks, over 85% of cases of disc herniation resolve.
Yeah.
Regardless of specific intervention or exercise or PT or whatever, 85% of them gone in 2 months, which tells us, again, we get back to life. We start exploring our environment and moving like we should as human beings on this world, and that back will start to respond to us and be gracious and say, okay, we went through a little experience, let's get back to the world and life, and let your back respond to that.
So let's talk about a couple strategies that we would recommend if you are experiencing or you've been told that you have a disc herniation. I like to go back to breathing, and I like to go back to breathing on the belly. I think that is 100% going to be always my favorite. One, that puts you in a little bit more of an extension bias when you're laying prone on your stomach. And if you cannot tolerate laying prone on your stomach, then put a pillow or two underneath your stomach, and that will help to prop the back up a little bit and take it out of too much of an extension pattern. And when you're laying on your stomach and you're going to be focusing on breathing, sometimes I have shown like rolling up a yoga mat. So imagine a yoga mat out laying long ways, and you fold it in half and then you roll it up almost like a sleeping bag. Like that's how I was taught in Girl Scouts. Fold it in half long ways, roll it up, and you put that underneath like the rib cage belly area, and you think about taking a slow inhale in from that low rib cage where that belly region where the yoga mat is. You take about 4-second inhale, and then you take about an 8-second exhale, and you start getting your body to melt into the pressures in the abdomen. And
you can feel some really funky things when you do this for the first time. It's pretty cool though. Yeah.
Well, you're going to be, kind of going into that diaphragm area. You're going to be going into releasing the pressures that you might be experiencing, especially the nerve pressures in that disc area, if that is truly what is happening back there when you're doing this type of breathing. So if you even just started with 5 minutes a day of that is one of my main recommendations, to just like start at a place that can get you asymptomatic and out of that acute experience of pain.
You talk a lot about this intersegmental, or this relationship between all of the joints and areas of our body, especially the ones it's right next to. I mean, if you have awful neighbors, your life's not great either.
Yeah.
And so if our neighboring joints have some restrictions or have some things, we as this amazing machine of a human body are the master compensators. And we do so without knowing until we start having a painful experience.
Yeah.
So exploring mobility in the hips, I would say, is something I need to do, because that's where some of my low back issues come from. If I can open up my hip. So a 90-90, I know you're big on the 90-90, exploring your hip internal and external rotation. And if we have limitations there, that could be causing us to move differently through the low back.
And I have definitely shown a ton on hip 90-90 if you just head to DocJenFit on Instagram.
Or just hip mobility in general.
Yeah, or even if you just sit on the ground. So this might put you into a more posterior position and add that flexion experience that could hurt at first. So propping yourself up, using hands, sitting on pillows when you're trying to initially start to get down onto the floor, but experience just sitting on the floor. It's so crazy what it can start to do for you. Don't forget that just because it might have happened picking up a pencil. Flexion in the spine is normal. That is 100% like what we want to drive home is that I've met PTs themselves who've experienced disc herniations and been told that they can't bend down to tie shoelaces. They can't put pants on because they need to maintain a neutral spine. And they get so fearful of movement until they start to learn more and kind of get out of that mentality, and they help themselves that way. We don't need to be afraid of flexion. It just might need to change right now. Eventually, the goal is to be able to flex the spine again. The goal is to be able to extend the spine, to rotate the spine, and then to load in all these different positions.
It is always a progression. And generally when we step outside that progression is when we have some sort of injury or some sort of non-optimal experience. And in looking to optimize the body, do something different and explore those mobilities and then working into load. So I love it.
So that is what will lead me into a shameless plug, because whatever, it just can help you observe your body and get to know your body and become aware of your body. Exactly what we were talking about is the mobility method, like being able to self-assess what is restricted and how could that be causing other areas of stress and strain within my body that causes pain.
For those of you who haven't heard of, I don't know how you haven't heard of, but haven't heard of the mobility method, this is the amazing program that Jen had put through that kind of helps you run through this self-movement assessment that, in my opinion, I mean, it brings your physical therapy right into your room, and it brings your physical therapy right onto the screen in a way that you can go through it step by step at your own pace. And there's so much education, and it really is that vital way to know, okay, I am a little bit limited here and here.
Yeah.
And I'm lucky to be a PT and was somewhat aware of those things. You know, since I've been with Jen, I've been able to advance my mobility work because of the environment I'm in and the encouragement I get there. But really, if you have any questions about how you move yourself or where you might be compensating, I will give the shameless plug with no shame. Me, personally, I need to work where? My ankles, my hip internal rotation, my thoracic rotation and extension. So you wouldn't be the only one.
Yeah.
Everybody has a few places that they can work to optimize the way they move and feel.
Again, don't be afraid of your disc bulge, your disc herniation. Explore your body. It doesn't mean that you can never go into flexion and that you have to keep a neutral spine. Neutral is going to mean something different for every body type. It's about exploring your body altogether. It is about understanding that if I only move one way all the time, just like if you only sit all the time, like we now understand that's not great, right? It's the same thing with your body. If you only move one way, it's probably not the best way. So the best way is all the ways.
Best ways all the ways. Hashtag it.
Thanks for joining us again on another Optimal Body PT Pearl. We are so excited to continue to give you knowledge about the body, open up your awareness, and create whatever optimal means within your own individual body. So please subscribe, comment below, let us know what you're liking, what you want to hear more about. And if you have any questions, we're happy to answer them within the comment section below as well.